Hi, I'm Chloe,
Hi, I'm Tanika.
and we are Five Times More. Today, we have a very special guest. We will be talking about all things postpartum bleeding.
Would you like to introduce yourself, Dr. Rumbi?
Absolutely. Thank you guys so much for having me. I'm Rumbi. I'm a doctor, so you can call me Dr. Rumbi, but we are friends here. So Rumbi is absolutely perfect. I am a doctor. I'm in my fourth year qualified as a doctor. I'm training to be a GP. Before I was a doctor, I was a midwife, and currently I'm working in obstetrics and gynecology. So the fact that you guys have asked me to speak about this topic I'm just honored to be here and really excited to have this conversation.
No, thank you so much for coming. And you have such a wealth of experience. So who else would we ask?
Literally, who else?
You guys have consultants on your roster, so I know I'm very privileged to be here.
Thank you.
Thank you.
So I'm just going to go straight in with the first question. Obviously, today's topic is postpartum bleeding. What is postpartum bleeding?
So once you've had a baby, whether you've had a baby vaginally, whether you've had a baby via cesarean section, the uterus, the womb, still needs to clamp down. Where the placenta was attached, there were all these little blood vessels, and that's how baby was getting their nutrition, and all of that. So all of those blood vessels still need to be clamped down by the womb or the uterus, but they will always be a little bit of bleeding from the vagina. And we tend to call that bleeding lochia. Most women, there's normal bleeding and abnormal bleeding. And I'm sure you guys will talk about abnormal, heavy, hemorrhage type bleeding in a different on a different episode. But today I think normal bleeding doesn't get enough attention. So I'm focusing a bit on normal bleeding. Midwives, doctors, etc. call it lochia. I have no idea what the word lochia means. It's probably Greek or Latin, or some clever person came up with that word. But it is really just that small, steady bleeding that happens after you've had the baby. And it is literally because of the little blood vessels that were connecting the womb to the placenta that just need to be clamped down and shut off bit by bit by bit. When I see women or birthing people after they've had the baby, trying to help them understand what's normal bleeding, I tend to describe, yes, if you're changing your pad every few hours, 4 to 6 hours is fairly reasonable, particularly in the first 2 or 3 days. Thereafter, it should steadily go down. I always say if you're passing clots bigger than about 50p, I haven't seen a 50p coin in a long time now, but if you're passing clots bigger than like 50p or a £2 coin, then it's really important to let your midwife know, because that's a bit more than we would expect, and it's always better to get it checked out. Also, yes, there's bleeding or lochia, but it doesn't usually smell, or it's not offensive smelling. So if you find that your bleeding or your lochia now has a funny smell to it, and you're like, I can smell that, it smells a bit funky, again, you should let someone know. Usually, we tend to say that about 6 weeks, all bleeding should be completely finished. But most women will find after coming into week 4, things have almost completely settled down. So that's what I would say really about normal post-delivery bleeding or lochia.
Okay.
I was going to say thank you. Thank you for explaining that. I think that makes so much sense. I don't know what you're going to add on to that, Tanika.
No, I was so excited to jump in because I was like, oh, thank you so much. And whilst you were saying that, I actually found out that it was a Latin Greek word. That's what I was researching. I wasn't trying to be rude. It's New Latin, Greek noun, use of the neuter plural of lochios, of childbirth. There we go.
English.
Lochios. Big English. Cool. Thank you so much. I think you answered a few of the questions that I was going to ask. Actually, how do you know if you have an infection? Because obviously you've got all of the steps that you've said. If it smells funky, is there anything else that you would know if you had an infection?
Absolutely. And I think the lochia is a really good indicator of when things are changing, or the fact that things are progressing normally, or maybe an infection is developing. So exactly like we said, if it smells funky, foul smelling, if it becomes heavy. So if your bleeding is settling down nicely, you're day 5, now you're just using little liners, you don't need pads anymore. And then 2 days later, you're having heavy bleeding again. That's a sign that maybe something's changed, something's not quite right. You need to get that looked into. And also how you feel as a person. Are you feeling feverish? Are you feeling just tired? And again, after having a baby, I read something the other day that pregnancy is like a marathon, and then delivering the baby is that kind of like final sprint. So it's understandable to feel tired, to feel like you're just kind of starting to pick up your energy again. But if you feel you're back in your flow, you're getting a bit of energy, and then all of a sudden things take a dip, again, that could be an indicator that something's not quite right, something's up. But the main things I would say are foul smelling lochia, increase in lochia. So it settles down and then it increases again. Again, if you're passing clots, if you're noticing things that don't look like blood in the lochia, it looks more like tissue is the wrong word, but it looks different to just normal blood. If you yourself feel unwell, feverish, high temperature, just feel sicky, that could be a sign that there's an infection there for sure.
Thank you. I do have one more question for you. How do women look after themselves during this period?
One of the things I always say is get the big boy pants, like get the ginormous pants, the ones that come up above the tummy. I've seen a few moms sometimes.
Sorry, when you say the pants, do you mean the not actual like pants? Do you mean the what they called again?
The pads, nappy things.
Pads.
Yeah.
Both. So you can do both.
Yeah.
Sometimes with the disposable ones that come a bit like pads, the waistband is a little bit, I don't know, I think it digs into skin a little bit.
Well, let me talk from past experience, because obviously we're going to be, sharing and stuff. I found a particular brand. I won't say which one it was, but I'm plus size. Okay, I'm a big girl. Okay, with a big assets, right? And I found my the pants that I used to be very comfortable. It literally felt like second skin. It didn't dig, it didn't feel uncomfortable. And when I was advised when I was pregnant, actually, to make sure that I buy them, because they're literally a game changer. And sometimes actually I use them just normally because it just makes sense. So it does work. It definitely does work.
Yeah.
And it does dig in.
I agree with you. I have one as well. It's a supermarket brand and it was cheap. It was like 12 for £6. I know some people might think that's expensive, but what it does, it makes so much sense. And I will name a brand actually. There's a name called Mum Bub Hub. They were also doing it. They're black owned, and I remember that I trialed a few of their nappies. I'm calling nappies, so I actually know the right name for it.
Yeah.
And since after trying their one, that's when I realized, oh my gosh, this is amazing. Because I know sometimes we see it in the shops, we walk past it and like, I don't need it. Why would I wear it? And I'll put it on with a dress or jeans, and it fits so well.
So I agree. I think that's part of the self-care, is having comfortable underwear where you feel that you're protected from leaks and you can be up and about in your day, especially in that first week where the look is a little bit heavier anyway. So definitely I would recommend that. The second thing in terms of birthing people looking after themselves is good healthy diet. Now let's do your fruits, your veg. Let's try and get your iron levels back to a good level. You've just had a baby. Delivery comes with blood loss anyway, so your iron level is going to dip. When we have low iron, sometimes we can feel our energy to be down, a bunch of other symptoms. So trying to build that up as soon as you can. Obviously, if you need iron supplements because your level is too low, have iron supplements. But if you don't need supplements, then please try and build that up in your diet. I would definitely recommend that. What do I do? The third thing, and this is not, I've noticed sometimes in the culture that we live in, our village or our family is not so readily available. So let's say mum lives in Manchester, sister lives in Cornwall, so families are spread out. But another really important part of self-care, I would say, or mums looking after themselves in this time, is leaning on your village. Can someone come and help you with the washing up? Can someone do the cooking, help you with the cleaning? So you can just kind of focus on looking after yourself and your new baby in that period. I hope that answers the question a little bit. I know I veered a little bit from bleeding specifically, but I think those are some three really useful things.
No, very useful. I want to go back again. So if I have postpartum bleeding and because you talked about the different stages and how long it should take, but if I have any concerns, who do I go to? Do I go back to my midwife, health visitor, or do I go to my GP?
If it's within the first 2 weeks, if you've not yet been discharged from your community midwife, then they are a great port of call. If it's like 10 p.m. at night, you can't get hold of your community midwives. Most maternity units, different places do different things, but most maternity units either have a triage on their labor ward, and that will still take calls from people that have delivered, or they have a maternal fetal assessment unit or a maternal assessment unit. They call them different things, but usually there is a 24/7 port of call where you can call and say, I'm worried about my bleeding is getting heavier, or my bleeding is becoming offensive. And then they would say, okay, come in, let's assess you. Or they'll say, maybe we'll send the midwife up to you tomorrow morning, like a plan will be made. If it's after you've been discharged from your community midwife, then I would say GP 111. Those are kind of good ports of call. But ultimately, from the doctor perspective, until you're more than 6 weeks after you've had the baby, as obstetric doctors, we would still look after you. So even it might have to come through A&E. So I see lots of mums currently in my job that maybe are 3, 4, 5 weeks after having the baby. They go to A&E for an issue, and then A&E calls us, and then we see them that way.
I actually didn't know that, so that's very good information to know. If you've got like a concern, maybe it's something late at night, it's after that 2 kind of week period and you've not been discharged, instead of waiting till the morning for a GP appointment, if you can get one, you can go to A&E and be seen there.
That's 111. And I don't know, again, this is the thing with the UK sometimes, everything is very postcode lottery based. Where I live, we have a really good out of hours service. So from 6 p.m. until 8 a.m. the next morning, there's a GP out of hours service. Where I used to live previously, this was a walk-in. You could literally just take yourself there.
Yeah.
The waits were nowhere near as long as A&E. But where I live now, you can't just walk in. You have to either call 111 and be accepted to come, or go to A&E and then A&E say this would be fine for out of hours and they refer you. So just depending on where you live as well.
Still good to know that information though, as somebody who, if this is your first time or second or third. So yeah, that's fantastic. I think that's all the questions for postpartum bleeding. Do you have any final thoughts? Anything you would like someone watching this that maybe might be a new mum or second time or third time mum to know about postpartum bleeding?
I would say if you feel that you're unsure whether or not this is normal, it's always better to ask for advice and be reassured than to be at home worrying like, oh my God, is something happening? And then maybe we missed the boat on something we could have treated or intervened nice and early. The downside with that is a lot of times people might feel dismissed. So they might raise a couple of things, and all these things are, that's normal. Yeah, that's normal. Yeah, that's normal. So then you feel scared to bring something up again. You feel scared to say, okay, I know I'm 10 days. Is this amount of bleeding okay? But literally, as the professionals looking after you, we're being paid. I'm being paid to be at work. So if you need to come and ask me questions, ask questions. Like, your midwives are being paid to be at work. Your doctors are being paid to be there. So don't feel scared to keep going back if you need to go back, if you need that reassurance.